So first, we have to slow down and remember how long it took us to make this baby and hold this baby. And I think we've brought some better awareness to the fourth trimester. So that's great that people are understanding that there is this 12-week period where there's a lot of healing and recovery going on. However, it doesn't end there.
Are you done with being that pregnant or postpartum mom in the gym who is always stuck on the sidelines feeling horrible, saying, "How come no one ever told me this?" Are you ready to finally say no to a mom life filled with excess weight, injury, overwhelm, and fatigue? Then help is here. Welcome to the Strong Moms Fitness Podcast, where we dive deep into the information you need to be the strongest woman in and out of the gym, even if you are a mom. If you are done going through your pregnancy or postpartum fitness journey clueless and unprepared, if you are ready to commit and say yes to being that badass fit mom who is shredded and stronger than before the baby, well, listen up. Because this is where we talk about all of the things your doctor or trainer never told you about, so that you can achieve the body you want and take your athletic strength and performance to the next level. Get ready, because here's your host, Daisy Bravo.
Well, hello, and welcome to the Strong Moms Fitness Podcast. I am here today interviewing Stephanie Perez, pelvic health physical therapist. She is here with us today to school you on everything pelvic health physical therapy. If you have never heard of pelvic health physical therapy, you are going to want to listen up. Whether you're pregnant or postpartum, pelvic health physical therapy is important to outcomes after baby and getting you back to the gym the right way without injury. Now, I want to introduce my guest today. Stephanie Perez and her husband have 2 daughters and 1 son. She is passionate about helping people and giving people hope. She offers a holistic approach to treatment, and her goal is to empower her patients and restore function and confidence in their bodies through pelvic health physical therapy. I am going to let Stephanie go into all the details and all the questions that may come up about pelvic health physical therapy. We're going to learn what a pelvic health physical therapist does, how we can make sure that we are doing what is necessary for our bodies at specific times during motherhood. And Stephanie's going to go through some of the myths and some of the do and don'ts and mistakes that some moms make before, during, and after baby. Thank you so much for joining me today, Stephanie, on the Strong Moms Fitness Podcast. I have been dying to have a pelvic health physical therapist on the show, and I feel like pelvic health physical therapy is the best kept secret when it comes to pregnancy and postpartum. So many moms join my programs and listen to my podcasts have actually never heard of a pelvic health physical therapist. So I would love for you to explain what your scope of practice is as a pelvic health physical therapist. Like, who do you serve? What do you actually do? And I'd love to know how you came to specialize in pelvic health.
Sure. So I work with women of all ages. A lot of them have had children. Some of them have never had children, with any types of problems that they might have or challenges they might be facing involving their pelvic floor. And the pelvic floor is a group of muscles that sits in the bottom of the pelvis. And for those of you listening, I know you can't see, but I've got my little pelvic model here. So they sit in the base of the pelvis like a muscular hammock, and they function to lift and support our pelvic organs. For females, bladder, uterus, and rectum, and males have pelvic floors too. They give that internal stability to our lumbar spine, the low back, joints, and vertebrae, and the pelvis. They provide sexual function, and they keep us continent so that we only pee and poop when we're supposed to pee and poop. And when we need to do those things, we do it well and fully. So some of the most common reasons where people probably seek out pelvic floor therapy is when they're already having challenges. And the most common challenges we see is urinary incontinence or fecal incontinence, especially associated with, oh, I pee a little bit when I laugh or sneeze or cough, or while I'm exercising. Double unders get me every time, box jumps make me pee, or any type of hard time holding gas in, or they might be having pain with intercourse. Sometimes it's related to post-childbirth, if we've had any type of perineal tearing or C-sections, or it could be not related to childbirth at all. And some of them might have some problems with fully voiding, or they say, well, when I pee, I still feel like my bladder has pee in it when I'm done, or I'm struggling with constipation. We can help with a lot of GI, gastrointestinal kind of challenges as well. So those are some of the probably most common pelvic floor related dysfunction. And there's a lot more. And then we help with pregnant women. A lot of pregnant women will have pubic bone pain or low back pain, SI joint pain, sciatica, or really any pain. A pregnant woman can have any other regular aches and pains that a regular person or a non-pregnant person might experience. And there's something that can be done about that. And I think culturally or typically when a pregnant woman's having aches and pains, it's just like, well, you're pregnant. That's just the way it is. You got to deal with it. But if it's something that's truly making you very uncomfortable to where it's affecting your daily life, there's things that we can do to help during your pregnancy and to support that growing belly, growing baby. So that kind of leads me into how I got into pelvic floor therapy as I became a pregnant woman myself and started having children. I had been a therapist for 5 years, I think. And I got pregnant with my first baby. I was heavy into CrossFit. I started CrossFitting in 2012 and really found a love for Olympic lifting, love snatches and clean and jerks. And I was doing competitions. And when I found out I was pregnant, I was very excited. We were ready to start our family. But then I started to feel very scared about how do I work out as a pregnant woman? Because there's not a lot of information out there. And we only had 1 or 2 coaches at the time at our CrossFit gym, and none of them had really had any type of education working with pregnant and postpartum women. I dove into the research and started doing a lot of research myself. What do I need to do? When do I need to modify? How hard can I go? What should I do? And taking that personal interest in my own body just continued to drive my desire to learn more and to help others. And then I had my baby, we had a great delivery, and then my postpartum came and I was ready to get back in the gym. Same thing. I wanted to do it safely and know how to support my body and its postpartum healing while getting back to the activities that I love, the activities that made me feel like me, but without much guidance. So really learned about postpartum, return to exercise and red flags and things to look out for and just how to support yourself overall physically. And so then I decided to specialize in women's health, pelvic floor therapy through Herman and Wallace. That's one of the kind of common schools of education out there for pelvic health for physical therapists. And the rest is history. So I've had 3 babies, all 3 natural vaginal deliveries, and worked out through all of them. Thankfully had good health during my pregnancies and have had good postpartum return to fitness.
Awesome. Wonderful. I love your story. That is beautiful. And I really want to thank you for bringing this to light. And I'm sure everyone has a dozen questions off of what you just said. But when someone seeks you out, should it be because they're in pain, or can someone reach out to you early or preventatively, especially when it comes to pregnancy and postpartum?
Absolutely. The answer is yes and yes to both of those. I highly recommend a prenatal visit to a pelvic floor physical therapist. Even if you are not currently having any particular problems in your pregnancy, there is a ton of information to gain from seeing a therapist. We do so much education, especially during that first visit. Everyone will learn something. So it's a really nice thing to do, especially if you're an exercising mom, just to go establish a care team member and help guide your pregnancy. I'm in my first trimester. Is there anything I need to do modifications wise? And then you can have these check-in appointments. So sometimes people will have these trimester check-ins. So they'll start with me at first trimester, and then we'll do a follow-up in the second trimester, and then a follow-up in the third trimester. Just check on body, how you're connecting with your breath and your pelvic floor. Help give that nice deep connection to pelvic floor relaxation. That will help with pelvic opening. And when it's getting into different positions as you're managing those contractions during labor, we go over spinning babies. There's lots of really good benefit and education to give a prenatal patient or client. I'll have a lot of moms that will come and just meet with me one time in their pregnancy. A lot of times it's not the first pregnancy, it's the second. And during the first one, maybe they had some challenges with something in particular. Maybe they had, a lot of pubic bone pain, or they had a bad tear, vaginal perineal tear, and they're seeing what can I do to help improve my chances of not tearing as much with the second one. Or maybe they're a VBAC and they had a cesarean with the first, and they really want to try for that vaginal birth after a cesarean. And what can I do to try to improve my chances of that? So those are all really cool things that can come out of seeing a pelvic floor therapist while you're pregnant, even if you're not quite necessarily having problems. And then same thing, especially in that postpartum period, we are trying to normalize a postpartum checkup with a pelvic floor physical therapist. In France, after you have a baby, you're automatically referred on to up to 10 visits with a pelvic floor therapist. It's their standard of care. And here, we just don't quite have that standard of care. There's just not a whole lot of maternal care and health support. It's like you have a baby, okay, and then you go on 6 to 8 weeks later, you have a checkup with a doctor, and it's very brief, very concise. And then you get this proverbial green light of, okay, thumbs up, return to intercourse, or you can start exercising again. But there's really no guidance to it. So that's a great time, is when you go to that follow-up with your practitioner, midwife, nurse practitioner, OB, whoever you're seeing for your birth team, to ask for that pelvic floor therapy referral. And then when you come in, we do a very thorough, comprehensive checkup on everything. So it's not just the pelvic floor, but we will address those pelvic floor muscles, make sure after we've had baby, does our brain and our body still connect and work well together? Do you know how to do a pelvic floor muscle contraction, also known as a Kegel? Do you know how to relax those pelvic floor muscles? Do you know how to engage your core, your deep core, your transverse abdominis? Do you have any diastasis recti or ab separation? Let's check that out. Are we having any imbalances in our hip strength? How is our posture looking? Are we falling into that typical mommy posture that we all fall into with our hips shifted forward? And just how can we address any imbalances that we have postpartum so that we can get nice and strengthened up and coordinated, so in the future we won't have any challenges or dysfunctions.
Well, I love that. That was so thorough. I appreciate that. Now, here's a question that I'm sure a lot of the ladies are thinking in their mind right now. And that question is, how invasive is pelvic health physical therapy? What should someone expect going into an appointment?
So usually during that first visit, if everyone's comfortable and ready, we can do an internal assessment. And the internal assessment involves the therapist using one finger to insert vaginally into those deep pelvic floor muscles so that we can check for any tenderness or restrictions. And then that's how we get the feedback for the strengthening. So while our finger is in the vagina, we'll have you do a pelvic floor contraction, and we feel that squeeze around our finger. We'll have you relax, maybe check some holds, see how the endurance is. We can do a prolapse check if we're having any of the feelings of any heaviness or bulging of those organs. And then that's it. So that internal assessment, a lot of people feel very nervous about it because like, I don't know what this is going to be. Oh my goodness. And we try to make it as quick as possible. We try to keep everyone as comfortable as possible with it. We try to have as much fun as we can with this because it is a little bit of a nervous, kind of uncomfortable subject that we are working on trying to improve that stigma or awareness of, to get people to open up a little bit more about it. But like you said, ultimately it is in a private area. And so when we'll screen for any history of trauma or sexual abuse, or if someone's just feeling very squirmish about it, it's okay to not do that internal assessment on the first day or ever. There are a lot of things that can be done with external treatment. Now, the gold standard is to at least do the internal assessment so that we know exactly what's going on. 40% of women don't perform a Kegel correctly or pelvic floor muscle contraction correctly. So that is very important to get that feedback so that we can say, yes, you're doing it right, or no, we're not doing it right, and educate and correct so that the person can have that confidence in their body that they're activating those muscles in the correct way. If they're not ready, then we wait until they are ready. Or a lot of times a woman will be on her period and they'll call and say, oh, I'm supposed to have my first appointment today, but I'm on my period, so I should need to cancel. It's like, no, don't cancel. Let's keep the appointment. We can do other things. And then when your period's done, then we can do the internal assessment next. And then after that, it's very patient dependent. So if really all they have is some weakness going on and we do the internal assessment, we see what's going on, we give the right cues, we give the exercises, then we don't have to do an internal work every time you come in. But there are some people who have different types of diagnoses. There's something called vaginismus, where basically they are unable to tolerate any type of penetration. So these types of women might have trouble wearing a tampon or inserting a tampon at all, or they're not able to achieve penetrative intercourse because they feel like it just won't go in, or they may have hit a wall. There's that feeling. And in those cases, a lot of times we're working on very tight pelvic floor muscles that we need to address with manual stretch. So if that is the diagnosis that we're working with, then usually we do some internal treatment each visit to help stretch and relax those muscles so that they can achieve whatever goal that they have.
Awesome. Now, how does someone find a pelvic health physical therapist? Are there subspecialties of pelvic health physical therapy? If let's say you're dealing with, prolapse, for example, how do you find the right person for you?
I'm glad you brought that up. It's very important to see someone that is specialized and certified in pelvic floor therapy if you are looking for pelvic floor therapy. There are a lot of companies, businesses that will say, oh, we offer women's health, we offer pelvic floor therapy, when no one is actually truly trained on internal assessment. And that's just doing an injustice to the community. We need to know exactly what's going on, and you need to see a professional is educated with the specialty of the pelvic floor muscles and how these things work. So anytime, if you're dealing with a dysfunction, prolapse, urinary incontinence, pain with intercourse, whatever, that's what you should definitely ask for when you're going to your OBGYN or your primary care physician. A lot of primary care physicians actually do a better job screening their patients for these types of things. So then you ask them, I would like to go see a pelvic floor physical therapist. And so you can get on Google, and there's a few different databases that you can search through. So through Herman and Wallace, if you just search Herman and Wallace, find a PT, I think theirs is called pelvicrehab.com. And that will tell you, you just type in your city and state, and that will tell you where everyone who's certified through the school of Herman and Wallace is located. And then another one is through the APTA, the American Physical Therapy Association. You can probably just search APTA, find a pelvic floor therapist, and then they can lead you through those who are educated in their school. But it's very important that you see someone who has that specific education.
That sounds great. So let's say you found someone potentially and you have an appointment for a consultation. I always go in with a notebook every time I go and see a new healthcare provider. And I usually have a list of questions, prepared or something so that I can make sure that we're going to be on the same page and we're a good like match for each other. Are there any questions that women should be asking on these first initial visits to make sure they're working with the right person, even if they have the right, credentials per se? Are there extra questions that we should be asking?
You can ask specific to what your kind of general life goals are. So if you're someone that's really into CrossFit and you really want to be in the gym and working out hard, then it might be good to ask the therapist, are you very knowledgeable in working with weightlifters or CrossFitters or anyone doing like HIIT type of training? Because there's a specific type of progression, of exercise progression that needs to be had so that you can get them feeling comfortable and strong in those particular movements. And if there's someone that's not quite knowledgeable of that, for example, I was talking to a girl who was seeing a therapist postpartum for about 4 months and really working to get back towards this kind of high intensity interval training programming. And she never got off her back for exercises. So if we're training, which it's always good to, I always start my patients on their back for creating foundation and making sure that we're checking in and getting it right. But then we move on to other positions. If your goal is to get back to jumping rope or doing box jumps, and you are still laying on your back doing exercises, then those don't match. So it might go be yoga or Pilates. So finding a kind of like-minded therapist as far as your fitness, I think that's important for your specific life goals and what you're ultimately trying to get back to. And then just asking questions like, so where did you get your education from? And how long have you been doing this? Do you work with many pregnant women, or do you work with many postpartum women? Do you work with this diagnosis often? And those can help give you confidence too in your provider. And then you start to form a nice relationship. And being open and honest is very important in establishing that good foundational relationship with your pelvic floor therapist. Because when you have that comfort, then you're going to be confident in the care you're getting and your body's going to respond better. And maybe bottom line is, if inside something doesn't feel right, I don't know, I don't really feel like I'm getting better, I'm just not sure if she's the right therapist for me, that's okay. We don't always mesh. All personalities don't always mesh. And that person might be a very educated, smart pelvic floor physical therapist. But ultimately, if you guys don't mesh well in your personalities, then that kind of lack of confidence might prevent some of your improvement and your progression. So just listen to your gut and your instinct about it.
Cool. Thank you for that. So my next question is maybe more so a myth that I'm hoping you can bust for us. And that is the myth that if you've had a C-section, you don't need any sort of pelvic health care. Is that something that you hear?
Yes, I'm so glad you brought that up. That is indeed a myth.
Mm.
So everyone who's had a baby needs to go into pelvic floor physical therapy, but there is that myth kind of floating around that, oh, well, if I have a C-section, I'll spare, and I'm using my air quotes here, spare my pelvic floor. Your body and your pelvic floor muscles have grown and supported the baby the whole time. So your pelvic floor muscles have been working, and they are very tired once you get to the very end of your pregnancy, and they are still going to need some rehab and recovery, even if the baby did not pass through that way. They still did the work. And I think some people think that having like a strong pelvic floor will help push the baby out. And it's not your pelvic floor muscles that are pushing the baby out, it's your uterus. So those pelvic floor muscles have still done the work, even if you did not have a vaginal delivery. And with C-sections, we really need to go see a pelvic floor therapist, because another one of those things that's not being told to moms is we need to do scar massage. We need to do massage to our perineal scars if we had any perineal tearing, but a C-section is a major abdominal surgery. And I think we've gotten away from the severity and the significance of it. It is there if we need it. It's very important to have it, but it's a major abdominal surgery. We've cut through a major piece of our core stability, and that rehabilitation from that procedure takes some very focused recovery. And so once that scar has healed and closed up nicely, we want to make sure we're massaging it. You want to have a nice pair of high-waisted supportive underwear to wear after to help support your belly and take some of the pressure off that scar as it's trying to heal. Using some silicone scar strips is good to help that scar lay down nicely. And then really doing a nice core retraining program. Since there was a surgery and we cut through the muscle, it takes extra focus and attention to get the brain working to the muscle again and get it firing well. So we want to do some good concentrated core strengthening, that deep core, that transverse abdominis, in addition to those kind of pelvic floor muscular hammock muscles and our low back muscles and our glute muscles.
Cool. I love it. I want you to touch now on maybe some of the most common mistakes you see moms or pregnant women make when it comes to their pelvic health. What are things that make you cringe?
So these are no-nos. Everyone hear me. These are no-nos. Probably the most common thing is just do more Kegels. When people have any type of problem that's associated with the vagina, it's just kind of this cultural thought that, oh, well, the answer is always Kegels. Even when you call the doctor, sometimes that's still being told to people on the phone. And no, that is not the answer. When we're having a dysfunction or a challenge with the pelvic floor, we need to see a specialist to help you find out what the challenge is, to see if indeed we do need to do Kegels. Kegels have their time and place, and it is important to be able to contract them and to know what that means. But however, it's almost equally important, if not more important, to know how to relax them. And sometimes we can actually have weakness and incontinence due to a tight pelvic floor. And so if your pelvic floor is already tight, the muscles are tight, imagine a hamstring, imagine a tight hamstring. You wouldn't try to rehab a tight hamstring by doing millions of hamstring curls. Like, that's not going to make your hamstring less tight. It's going to make it more tight. It's going to make your leg be restricted. You're not going to be able to walk normally. Pelvic floor muscles are muscles just like any other muscle in your body. And if the problem is that there's too much tension in the system, then we need to focus on how do we relax the system and manage the pressure so that there's not an increase. So that's probably the biggest one that we see. So the answer is not always just do more Kegels. One of the other most common ones that I hear people say is, well, when I pee, I strengthen my pelvic floor by starting and stopping my urine a lot. And that's another big no-no. As I'm giving cues to people, when I say, do you know how to contract your pelvic floor? I'll use the example of, it's as if you were sitting to pee and you stopped the flow of urine. And that's just supposed to give a connection. Oh, yeah, I know how to do that. Or I'll say, you can do it one time just to see if you know how to do it, but then don't do it anymore. And when you are urinating, you're trying to be in a relaxed position so that the muscles will let go, so that that sphincter can open around the urethra and let all the pee out. When you start to put tension in the system at a time when there's increased pressure from above, you start fighting yourself. And then you can actually set up urinary hesitancy or incomplete emptying because you're not letting those muscles completely relax so the bladder can completely empty. So no starting and stopping the stream when you go pee-pee.
Need like a rule book.
Yep.
No, don't do this. Don't do that. I love it.
And there's one other really good one that we can all take away is no jicking. That's J-I-C, just in case peeing. So I think a lot of times we see this in the gym. It's like, hey, I'm about to start my workout. Let me go pee real quick. Or some women do it every time they go to leave the house. Mm-hmm. Well, let me pee before I leave. Or let me pee before this. And so we don't need to pee just in case. We need to only pee when our bladder tells us that it's time to pee. Now, I'm not talking about that random road trip every now and then where you got one gas station and you don't know when the next one's coming. The occasional thing is not going to make or break us. But when we make a habit of going pee just in case, then we actually mess up our natural bladder-brain communication. And so your bladder is like a muscular tank. And through the day, it fills. And as it fills, it stretches. And as it stretches, it sends signals to the brain when it's time to go pee. So when you start peeing before your bladder actually tells your brain that it's time to pee, then you can lower those sensitivity lines of communication. So instead of when your bladder's 3/4 full, it tells you to go pee, then it starts to tell you to go pee when it's only halfway full or a quarter full. And then you set up urinary frequency. So if you feel like I pee every hour, like I literally pee all day long, then you might be having urinary frequency. And we need to start doing some behavioral analysis of, are we peeing just in case? How much water are we drinking? And those types of things like that.
That's too funny. And I really appreciate that you talked about those 3 main points there. That's going to give a lot of take home, tips that our listeners can use. And here is a huge question I get, and I was hoping that maybe you could touch upon this. And of course, the women that I deal with mainly, and yourself also, are CrossFit athletes. Do you see in more athletes that they walk around with a contracted or tight pelvic floor? Do you find that higher intensity athletes are the individuals that have the tighter pelvic floor and they are harder to work with and retrain?
Sometimes yes, and we all get mommy posture. As that baby grows and that belly grows big, we fall into this backwards lean look because we don't need to fall over. So our body does this natural adaptation, and then after baby comes out, we've just been in that posture for so long, we just stay that way. And it's this kind of stance with our glutes, our pelvis kind of tucked under, so a little bit of a posterior rotation. Glutes are flatter. Some people will notice their glutes don't look as rounded after baby, and that forward shoulder from baby wearing and or nursing all the time and leaning over and holding bottles. So we all fall into that. But I think especially those with, I like to call it athlete brain, or those that are like, well, I'm an athlete. I was an athlete before, and I'm going to get back to the gym. I know how to work out. I know how to do all these things. So I might not need as much guidance from a professional. So they take mommy posture and then they go back into the gym. And then they start working and they're doing their squats and they're doing their deadlifts, they're doing all those things in the mommy posture. And when you're in that posture with that posterior pelvic rotation and that butt tucked under, it doesn't give you full access to your glutes. So you're not able to activate them as strong to support that pelvic floor. And with that kind of forward sway of the pelvis, it's almost like the belly's a little bit on stretch. And when those abdominal muscles are forward and on stretch, they don't have as good activation either. So that kind of refers to, it's called the length tension relationship. A muscle will have better activation when it's in its most optimal position. And when it's stretched or shortened one way versus the other, and its opposites, it might not be able to activate as well. So when we talk about what is our core and what is our pelvic floor, it's not quite this such separate thing. It's like your whole midsection, your abdomen is like a giant canister, and we call it the core canister. So the top of the canister is the diaphragm. The bottom of the canister are those pelvic floor muscles and our glutes. And then the sides of the canister are your abdominals and your low obliques and your low back muscles. So we need everybody, all those muscle groups, to work together and in coordination to handle increased pressures in our abdomen, like when we're working out. So if you've got your glutes turned off, they're not firing real well to stabilize. You've got your abs turned off, they're not firing real well stabilized. That's a lot of pressure on your pelvic floor. So then the pelvic floor starts to tighten because it's trying to make up for, well, the glutes aren't doing well, so I'm going to make up for them. And then my abs aren't doing well, so I'm going to make up for them, plus their regular job. So then they get real tired and worn out. So we take that over time and compounding, because that athlete is like, well, I'm working out, I'm getting stronger. I don't know why this isn't helping. And then we start our double unders or we start our box jumps and we're leaking. And it's like, what is going on? And it's because of that postural imbalance in a lot of those cases.
Sure. Awesome. I love that. That's pretty cool. How do you go and assess someone to figure out if they have a tight pelvic floor or a pelvic floor that's weak. Is that from your internal assessment?
Usually it's mostly from that internal assessment. From that internal assessment, we can feel if the pelvic floor muscles are holding tight and guarding. And then the patient will give us the feedback. It's like, oh, it feels tight right there, or that's tender right there. And same thing in the opposite way. If the pelvic floor is weak and the muscles just feel more like relaxed and soft and squishy, that's showing a low tone of pelvic floor. So the brain's not having a good neural communication to those muscles for that firing to happen. And then we have them do that active Kegel or that pelvic floor muscle contraction, and we see how the performance is. So you can still have the tight pelvic floor with a poor performance where it's weak. And then you can have the same poor performance from a kind of looser or more lax pelvic floor. And we see both extremes after deliveries. So that's why that internal assessment is golden in knowing exactly what's going on. But I feel like I've gotten pretty good at making some hypotheses with my interview. So as I'm talking to the person and asking these different screening questions about their symptoms, and I'm doing their postural analysis, I'm seeing what they look like, I'm checking their muscle strength of their hips and their core, I can start to make these guesses. It seems like I'm probably going to find that your pelvic floor is tight, but we're going to check and see. And I'll be like, yes, I was right.
Nailed it. Awesome. Wonderful. So, yeah, another reason to go and visit a pelvic health physical therapist. What advice do you give to newer moms who want to get back into that higher intensity fitness and especially running? How do you know when you're ready to get back into running? And what does getting the body ready for running or high intensity, like plyometric type movements look like?
So first, we have to slow down and remember how long it took us to make this baby and hold this baby. And I think we've brought some better awareness to the fourth trimester. So that's great that people are understanding that there is this 12-week period where there's a lot of healing and recovery going on. However, it doesn't end there. And I think a lot of that is commonly thought, especially a lot of people are going back to work at 12 weeks. And so we have this thought process of, well, I'm 3 months postpartum, like I should be fine, I should be back to normal, whatever. But we were pregnant and heavily pregnant for a lot longer than 3 months. So keeping physiology in mind is that first key of it doesn't matter how athletic you are or how good of genetics you have on your side, you still need time to heal. And there's no way to change that. You can't speed up healing. So time is that first thing that we've got to remember and keep in mind. Postpartum is technically forever, but when we're talking about, people will still say, well, how long do you think and when do you think? And I always say 2 years. We really need to think 2 years postpartum when we're thinking of, okay, am I back to some sort of baseline to really start to worry? Like, do I actually have a problem? This still hasn't gone away yet. It's been 3 months. Well, we need to give it a lot more time, especially if we're breastfeeding. You can still maintain in this loosey-goosey, hormonal, unstable frame up to 6 months after you stop breastfeeding. And so we have to give our bodies this patience and this time and this grace and the space to be kind to ourselves and support our body in its healing process instead of killing it in the gym. It could actually postpone that healing. So first, of course, if you're trying to get back in the gym or trying to get back on the road running, absolutely go see a pelvic floor physical therapist, at least for one visit. Get some guidance of how to get back there. I have a nice little chart that's made from my pelvic floor muscles on Instagram. She has a chart, and I'll give it to my patients who want to get back to running. And it's like, can you do this? Can you do this, 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 this? Yes. Did you have symptoms? And I'm like, well, you need to work through this whole chart before you can say, yes, I'm ready. And so running is a series of single leg stance. It's a series of balancing on one leg. So we need to be able to balance on one leg well without our hips dropping. I like to say, practice balancing on one leg every time you brush your teeth. That's an easy way to kind of mix it into your daily routine. and have good coordination and understanding of that breath work. And then as you are experimenting and playing with these, modifications and progressions, you have to listen to your body. And if you start to have symptoms, then I'm not quite ready for that yet, and I need to back down. I'm not saying you won't be able to do that thing forever, but you're just not ready for it right then. So especially with running and jumping exercises, we need to start with low impact and do things that can still get your heart rate up. Get on the bike, get on the rower, and then slowly progress the input, the jumping. So maybe start doing some hopovers over the dumbbell instead of your jump rope. The impact, that's the word I was looking for. So start with doing dumbbell hopovers for a lower impact version of jumping. Instead of doing box jumps, let's do box step ups. Can we step up and step down without leakage? And then when you're ready, start with a low surface to jump on. Can you jump up on a low surface? Step down, and then increase that surface. And then with running, we want to start with intervals. So walk 2 minutes, jog 30 seconds. Walk 2 minutes, jog 30 seconds. Do that for 10 to 15 minutes. If you can do that without symptoms, then let's go walk 1 minute, jog 1 minute, and just slowly increase those intervals. It's in a very supportive way as you're monitoring your body to see if it's ready.
Cool. I love that. I feel like everyone that just listened to that needs to go back another 3 minutes and re-listen, because so many truth and knowledge bombs you dropped right there to help women get back into high intensity sport. I want to thank you so much for joining me today on the podcast. And I'd like to give you a moment to plug your work. How can people learn more and find you online?
I work in the clinic, and I also work privately. I do virtual consultations and concierge home visit work. My company's name is Empowered Wellness Physical Therapy. And you can find me on Instagram at Pelvic PT Mama and www.empoweredwellnesspt.com. And if you have any questions or just want to know anything or talk about setting up, you can send messages through my website or find me on Instagram. But my whole platform and kind of goal is just to do community education and to get more info out there to you guys so that we can start improving our maternal health.
Cool. Well, thank you. I appreciate you coming on today. I am going to link to your website and your Instagram on the show notes so that anyone that had missed that can jump on and get all that information. And I really hope to do another interview with you soon and talk about some of the more specific stuff that come with kind of pelvic health, physical therapy, and rehabilitation of moms. So thank you again, Stephanie. I hope you have a great day, and thanks for joining me on the Strong Moms Fitness Podcast.
Thank you so much.
Oh my gosh. Well, those knowledge bombs from Stephanie are awesome. If a lot of what Stephanie talked about resonated with you, and maybe you are struggling with things like leakage, diastasis, prolapse, or if you're just someone that wants to get back into the gym safely after baby without injury, I want you to check out my program, Rebuild After Baby. And you can sign up for this program anytime. And I walk you through 8 weeks of fixing issues like leakage, diastasis, prolapse. We rebuild and re-strengthen the body so that you can get back to the fitness that you love. And the website is rebuildafterbaby.com. And I'll post that in the show notes for you as well. Thanks again for joining me on this episode of the Strong Moms Fitness Podcast. I look forward to seeing you again next week. Have a great day.
Thanks for tuning in, and we look forward to seeing you next time on the Strong Moms Fitness Podcast. Now remember, go subscribe so that you are the first to know as soon as new episodes drop. Also, be sure you don't miss out on your chance to win a free program of your choice from Strong Moms Fitness. All you have to do is leave a 5-star review. Screenshot it before you submit and send it to Daisy at strongmomsfitness.com. Your review helps other people find our show. And as a thank you, once a month we choose the review that makes us all warm and tingly inside and award that lucky lady a free program of their choice. So do it now. It could be you. See you next time, you badass mom, you.